Dr. Tanvi, and I'm a practicing consultant neurologist practicing at Kangra, Himachal Pradesh. Today I'm going to talk about the importance of consistency and recording in patients with epilepsy. So epilepsy is a very common disorder in our society. It is a brain disorder which is associated with a lot of stigma also. In epilepsy, there are episodes of abnormal discharges, electrical discharges in the brain, which leads to abnormal movements of the body. So the seizures can be of multiple types. There are some small seizures and there are some big seizures. So it is very important for the attendants of the patients to record these seizures clearly and tell them to their doctor, because the importance of recording is very much important in the correct diagnosis of the epilepsy and the correct diagnosis of the epilepsy through a clinical scenario, because that decides that from where these discharges are coming in the brain, from which part of the brain these discharges are coming, so that later on their doctor can correlate it with the EEG and MRIs and can come to a final diagnosis. So it is very important for the patients with epilepsy to record their seizures very clearly and tell it to their doctor. Secondly, the medications are very important. The consistency in medications is very important. Epilepsy is a brain disorder, but it is definitely curable. The medications actually keep the discharges under control. So if the patient misses out medication, even single dose, then there are chances that he can get seizures. So when we start a medication for a seizures, we give medications for at least 3 to 4 years, and then we start tapering off after 4 years if the patient doesn't have any seizure in these 4 years. But during these 4 years, if the patient gets seizures again and again and again and again because of inconsistency in their medication or because of non-compliance in their medication, then there is no point of stopping the medication. Then we have to restart the medication again and again and again and again, and patient ultimately this will lead to him taking the medications for his whole life, which can also lead to a lot of side effects. So if a patient wants that the medication should be continued after should be discontinued after some time, then he should definitely be very particular about the timing and the dosing of the medication, and he should be consistent with the medication throughout the course of medications. Then secondly, a patient should not stop medication on his own. He should definitely consult his doctor, particularly a neurologist, before stopping the medication, because these medications are not stopped abruptly. They are being tapered very slowly so that the patient doesn't get recurrence of seizure again. Then the recording of seizures is also, again, I want to talk about the recording of seizures. Recording of seizures is very important because that tells the doctor that what is the correct diagnosis of the patient. And depending upon the diagnosis, the treatment is decided, the medications are decided. Whether it is a focal seizure or it is a generalized seizure, the treatment is decided upon the type of seizure. So it is very important to record the seizure and also do the EEGs regularly for the patients of epilepsy. So that's all I wanted to talk about the epilepsy. Thank you.